Right, so immediately after that last podcast, I am actually intrigued to continue sharing more. So, welcome to today's episode of Yamcha Therapy again. Here's Hayden again, and I'm so glad to have you here to deep dive into a topic that touches on one of the most important and often overlooked areas in autism, which is emotional regulation. If you worked with or supported autistic children or adults, you've probably seen how challenging emotional regulation can be. Whether it's experiencing sensory overload, struggling with social interaction, or navigating intense emotions, emotional regulation is often a hurdle for many on the spectrum. But the thing is, it doesn't have to be. With the right strategies and support, individuals can learn to understand and manage their emotions in ways that make them feel empowered rather than overwhelmed. Now, over the last month, of course, working as sensory special needs teacher and 6 months of as a special needs therapist, I've seen firsthand how emotional regulation can affect everything from classroom behavior to social interaction and academic progress. The challenge isn't just teaching new skills, it's teaching emotional awareness and management. All while navigating the sensory, social, and cognitive differences that comes with being autistic. So imagine this. You're in a classroom or therapy room and a child is starting to get upset. Maybe their face scrunches up. They begin to flap their hands or their body become rigid. How do you respond? Do you see this as just behavior? Or do you recognize the emotional state behind it? So we're gonna unpack that. We'll explore that, what emotional regulation is, why it's crucial, and how we can support the development of emotional skills in a way that is respectful, effective, and understanding. All right, are you guys ready? Let's begin with the basics. What is emotional regulation? At its core, emotional regulation is the ability to recognize, understand, and manage one's emotional state. It's about knowing what you feel, why you feel, and what you can do to deal with those feelings in a healthy way. For neurotypical children, this development starts early and usually happens more automatically. They learn to recognize their feelings like sadness or frustrations, label them, and then find ways to express those feelings without causing harm or distress. However, for many children on the autism spectrum, this process is way more difficult. Autistic children may struggle with self-awareness of their emotions. They may not always recognize when they're becoming upset or may not have the words to express what they're feeling. Furthermore, they might not yet have the coping mechanisms to self-soothe or adjust their emotional state. This can lead to meltdowns, shutdowns, or other challenging behaviors when they are overwhelmed by their emotions. This is why emotional regulation is so crucial. Imagine a child who can't identify their frustration when a task becomes too difficult. They might lash out or retreat instead of expressing their needs. But why they can start to recognize that frustration, label it, and then express it in a way that others can understand. Their ability to function and interact with the world grows immensely. As educators and therapists, our goal is to help these children develop that awareness and give them the tools they need to express and regulate their emotions. When emotional regulation is nurtured, children are more likely to feel safe, understood, and confident which opens the door for social engagement and academic success. Now we understand the importance of emotional regulation. Let's talk about the triggers that can lead to emotional dysregulation in autistic children. These triggers can vary widely, but they often fall into three main categories: sensory overload, social stress, and routine disruption. Allow me to repeat: 1. Sensory overload, 2. Social stress, and 3. Routine disruptions. Let's start with sensory overload. Sensory overload is perhaps one of the most common triggers for emotional dysregulation. Many autistic individuals experience heightened sensitivity to sensory input, whether that noise, light, texture, or smell. For example, imagine you're in a crowded, brightly lit room, and there are several conversations happening at once. For a neurotypical person, this might just feel like background noises, but for someone with sensory sensitivity, this could be overwhelming. The child might start to cover their ears, becoming agitated or shut down completely. Recognizing sensory overload as a trigger is crucial because it allows us to intervene before emotions escalate into a meltdown. Then we talk about social stress. This can also be a significant trigger. Autistic individuals may struggle with social cues, nonverbal communication, and the unpredictability of social interactions. A child may feel anxious or frustrated when they don't know how to start or maintain a conversation, or they may misinterpret a peer's tone of voice or facial expression. This confusion or discomfort can lead to emotional distress, and if not recognized and addressed, it can result in withdrawal on aggressive behaviors. And the third one is routine disruption. This can be a big, major factor in emotional dysregulation. Many autistic children thrive on predictability and structure. A sudden change in routine, like a surprise fire drill, a change in the schedule, or a new person in the room, this can create a great deal of anxiety and upset to them. The child might not be able to process the change right away and might act out as a result. As a teacher or therapist, it's important to be proactive in recognizing these triggers. For example, in my own practice, I've noticed that some of my children I work with begin to show early signs of anxiety, like fidgeting or becoming quieter before a sensory overload occurs. Some even have their hand over their ears too, if it's too loud, of course. Recognizing these subtle signs allows us to step in with a calming technique or an accommodation before the child becomes overwhelmed. One great strategy is using visual schedules. This can help children anticipate transitions, reducing anxiety and improving emotional regulation. So, how can we actively support emotional regulation? There are a number of strategies that work well. Depending on the child's needs and triggers, I could think of some to be effective. So the first thing to me is building self-awareness. A huge first step in emotional regulation is helping the child build self-awareness of their emotions. This can be done in a small, manageable step. One strategy using emotional charts with picture or simple words to help the child label their feelings. For example, if a child starts to show signs of frustration, you might say, "You look upset. Are you frustrated? Are you angry?" You can ask the child to use their hand and point at the picture on what they really feel. The wording part is more towards letting them aware that this emotion is connected or correlated to this word. So over time, this helps the child connect the physical signs of emotion, like clenching fist or furrowing brows, to the emotional state. The goal is for the child to recognize and name their emotions before they become overwhelming. I also think that teaching coping strategies is very useful. Once a child has some self-awareness, the next step is to teach them some coping strategies, of course. These can include deep breathing exercises, squeezing a stress ball, or engaging in a quiet activity like drawing. In the moment, these strategies can help the child to calm their body and reset the emotional state. For example, a child who becomes agitated when transitioning between tasks might benefit from a short sensory break, or using a calming corner in a classroom where they can retreat for a few minutes. Another powerful tool in my perspective is to create a predictable environment for them. Using visual schedules, as mentioned earlier, can give children the clarity that they need to anticipate changes. This is particularly important for children who struggle with transitioning or have a hard time managing unexpected events. If you know that a child struggles with loud noises, you might warn them in advance that there will be a loud noise in the classroom, offering them noise-canceling headphones or a calming object that can help them stay regulated during that sensory overload. I also think that positive reinforcement is a key part of both ABA and neuroaffirmative practice. When a child successfully uses a coping strategy, be sure to praise their effort and reinforce the positive behavior. For example, if a child uses a deep breathing technique to calm down, you might say, "You did a great job calming down." With your breathing, for example, like the child is overstimulated and they kind of like use deep breathing techniques, this would be a good way on supporting them, being like, "Oh, you did good breathing, good job, wonderful effort," a lot of praises for them. This will like give a lot of confidence to your child. So by blending these strategies with ABA techniques like reinforcement and neuroaffirmative practices, which focus on respecting each child's unique needs, we can create an environment that encourages emotional regulation and growth. Of course, the reinforcement idea of emotional regulation is not just about avoiding behavior, but also about empowering the child to choose a healthier response rather than like a potential injury to any other peers. So, as a conclusion, to wrap things up, let's take a moment to reflect on how emotional regulation is a critical life skill for autistic individuals, and for everyone too, really. But for those on the autism spectrum, it requires a tailored approach that respects sensory needs, social struggles, and individual preference. As teachers, therapists, and parents, we have the power to create environment that supports emotional growth through understanding strategies and patience. Whether you're using ABA techniques to teach specific skills or neuroaffirmative practices to respect a child's unique sensory world, the goal is always the same: helping the child feel heard, safe, and empowered to manage their emotions. It's not just about managing behavior, it's about supporting the child mind, body, and emotions. Thank you so much for listening to today's episode. I hope you're having a great day ahead, and I will see you next week.